Well, welcome everybody. Sorry for our glitchy beginning. This is the first official day of our health policy camp. Day one. Thank you all for joining us. We have a great panel of speakers that are going to join us this evening. Next slide. So I want to start with talking about AJE. Let's just talk about AJE. So we're Advocates for Justice in Education. We were founded in 1996 to educate and empower parents to be effective advocates of their children with disabilities and special healthcare needs. Our approach is an empowerment approach, and that we believe that a big part of addressing injustices is appropriately done through an empowerment model. AJE, we take on services in three parts, which is direct services. And for us, direct services means our family support case managers who help families navigate the education and the other systems of care. And we also do trainings, and that is both for professionals and for parents and for youth as well in navigating primarily the special education system. But as we have more heartily taken on the healthcare system, we're also going to increase our support in those regards and the social safety nets in general. And then systemic advocacy. So the Health Justice Project comes out of our system advocacy work. While we do have our parent ambassadors and we have our community health advisory panel, and we cherish those relationships are for system engagement. So we do not, on this team, do one-to-one support. Should somebody need critical, more intensive support, we would refer them to our other teams. And also part of direct services is our legal team, and our legal team does take on one-to-one cases, but not every case escalates to that need. The most critical cases. Next slide, please. And so just a little bit more about the Health Justice Project. We started our project in 2021 formally, and it started as a 5-year campaign to address health disparities in DC, particularly looking at wards 8, 7, 5, and 1. And we do this by advancing parent-led advocacy and collaboration with healthcare professionals and policy decision makers. We added Ward 4 in 2023, and the 5-year plan that we started on with is expanding, and we definitely plan to continue with this project beyond the original concept of that 5-year scope, which started with the Robert Wood Johnson grant. Next slide. So today's agenda is what is in the live binder, and the link for the live binder, if somebody can put that in the chat, it's also in these slides here. We're just going to keep doing welcoming. We hope that just to save time, and because we started a little bit late today, we ask that you put your name in the chat if you want to know others here. We won't be able to do a lot of community building and wellness as we're used to doing on our regular Tuesday research meetings, but we hope to incorporate wellness throughout this in other ways, particularly at the end of the camp in our in-person parent cafe. And if you want to put your title, if you're affiliated with the organization, please do that. We're going to have our speakers, and they're going to give their remarks, and then we're going to have a moderated conversation and Q&A. And we hope that you take the time to fill out our evaluation form and stick around for some of the camp activities. Next slide, please. So this is the link. It's a short link for the camp binder. In the binder, you're going to see a detailed agenda, bios of our speakers. So on these slides, we only have our speakers' titles and their names, but if you look in the booklet, it has their detailed information, so you know more about their work and more about them. There's also great resources that we have there, including our community health resource manual, our peer support mutual aid toolkit, one-pagers to support the knowledge sharing that we're going to be doing here and in the other panels and workshops for the camp. And so I'm just going to briefly talk about healing justice, and we're going to kick it off to our esteemed panel. So just heads up to everybody on here. We will be uploading the panels on our YouTube channel, on the AJ YouTube channel. And so for those who are not able to join us in person today, we definitely look forward to having you be a part of this community, this learning community, using our YouTube channel, and we'll circulate that for all the people that registered and may not be present in this particular moment. And so our panelists, very excited for the dialogue that's going to come out of this. Is first panelist is Crystal Jackson. She's a doula equity consultant and post-delivery doula. She owns and operates her company, which is a Queen Mama Doula Services. And Dara Gold is a staff attorney here at Advocates for Justice and Education. So one of my colleagues here, very excited to have her. And
Dara Gold es una abogada.
Uh, Next, we have Veronica Mosqueda, who is a debt doula and a very close ally in the community. Her company is called Consciously Dying, Muerta Consciente. And we're being moderated today with our own Maria Bloyer, who is Team AJE and leads the Parent Services Division. So I will pass it on to Maria, and we'll stop sharing our screen and get going on the panel discussion. Very excited. Thank you all for being here.
Wonderful. I'm really excited to be here, and thank you, Chioma, for that kind introduction. My name is Maria Bloyer, and my job is to kind of keep us kind of sort of on track a little bit. I've got some structured questions, um, but I also know that Crystal, Dara, and Veronica are kind of prepared to lead off with some kind of opening remarks about what we're talking about today. And what we're going to be talking about today is really two chunks of things. One is the idea of healing justice. So what is that? What does that mean? What does that look like for you personally and professionally? And then also the social and political determinants of health. You know, I always used to shorthand this as the social and economic determinants of health, but I think that the way this team has phrased it's really great. The social and political realities that are leading to our health outcomes. If it's okay, I was gonna tag Crystal to start us off because she got here nice and early. And I kind of don't like AJE people talking back to back. So I was gonna go Crystal, Dara, Veronica, if that works for folks. So Crystal, you're up. And welcome. Thank you for being here with us.
Hi, thank you. Good evening, everyone. As we, heard the wonderful introductions, I'll briefly reintroduce myself. My name is Crystal Jackson, birth and post-delivery doula, doula equity consultant, and just advocate for maternal health, but like in all the ways that that happens. And so the pillars of a Queen Mama Doula Services are community, confidence, and care. And so again, like whatever that looks like, I'm here to support that, to uplift that, to advocate for that. And as it pertains to healing justice, I think coming from the birth work frame of reference, what that first means to me is just like an expansion of reproductive justice. Are either of you all familiar with that term? Yeah, okay, good. Glad to see some heads nodding. And so to me, that just like broadens that idea, that framework, which just allows for autonomy in all of our decisions around bringing children into the world and how we do that. So I'm happy to dive into discussion a little deeper. Thank you all for inviting me to this space.
Hey. Dara, did you want to add anything? I'm sure you want to talk about autonomy and self-determination as part of this a little bit.
Oh, I'm not quite sure what you're referring to in terms of this discussion. You want to give me a little hint and then I'll bounce off of you there because I was going to go on the education ecosystem cycling with health aspect.
Right. So one of the things we talk a lot about in special education in particular is the ability for young people to leave secondary, leave high school with the ability to live a self-determined life and to have autonomy. And I feel like that was something that Crystal mentioned there at the end with, the reproductive justice and the ability to have bodily autonomy and, control your decision making, whatever that means for you. And I feel like that's something that Dara and I work on a lot, is trying to give people, the self-determination, the skills and the knowledge they need to be truly self-determinative in their lives.
Yeah, I absolutely agree. That goes for the parents letting their little chickadees go out into the world, as well as their empowerment journeys for their educational advocacy. And the whole point of a free and appropriate public education is so you can be a productive, happy, healthy citizen out there in the world. Whether it's learning how to balance your budget, understanding how to find a doctor's appointment, paying your rent, finding that apartment, being able to have your own family to then begin to help advocate for their needs. And if you start your day on a bad note, whether it's social, emotional health, your physical health, everything is going to tumble down the road. So as I said, it's all interconnected, and I'm looking forward to giving you all from a little bit of the legal and advocacy perspective and how you can add that into your practice.
Okay. And we get Veronica, who's like continuing the spectrum of the life. We go from,
I
very
know.
early to the school and then parenthood. And then we have, we end up with this end of life conversation, which I really love that you're here, by the way.
Yeah. Hi, everyone. Hi, Maria. Thank you so much. I'm so happy to be here. Also, yeah, just reiterating a little bit. I'm Veronica Mosqueda, and I am a death worker and founder of Conscious Dying Muerte Consciente. And I'm also a community organizer with over a decade of experience in housing justice, migrant justice, criminal legal justice reform work, both here in DC and in Texas. And I moved through my work grounded in a praxis of healing and values of racial and economic justice and language justice. And of course, the community organizer in me, wherever I go, building power in in working class, low income communities and BIPOC communities and immigrant communities. And you know, uh, what you just said about autonomy and self-determination absolutely resonates because when I think about health justice, when I think about really just justice across the board, all of our struggles are deeply interconnected, right? The spectrum of life is is in relationship. They're all in relationship with one another, and we do not move through single issue lives, right? Thank you, Audre Lorde. Uh, and I think of really in broad terms, like people really being able to self-determine what are the best choices for them and being able to make those choices, being able to move through the world by making informed choices and having access to the information, right? Whether it's the education, the options, literally the I know we're going to get into it, the social determinants of health, right? Like housing and access to so much, including, right, like food. I'll reel it in and just saying that I'm really thrilled to be here because all of these things are in deep relationship with one another. And when I often think of end of life work, it's really about people need to be able to live thriving, just happy lives in order to arrive at their season of death and dying and in a way that they're able to confront that as well, right? And also, we know that there are so many communities that are already disproportionately impacted by needless death. While death and dying are natural processes of life, they are there's a disproportionate impact on so many communities and yeah, it's terrible. And I think that there are a lot of things that we can do to mitigate that, but also to offer the support that people need through their end of life experiences and grief experiences. So yeah, happy to be here.
Great. I love that you mentioned that, that all of these issues are deeply connected and interconnected. And I think that's absolutely true. So I'm going to stay with you because you mentioned social determinants of health. So you're stuck with us for a minute. And the ones that were listed for me were housing instability, transportation access, infrastructure issues, access to education, food insecurity, but I would also say there's lots of other social determinants of health, language access, um, the racial environment that you live in, all of those factors are huge. And I'm wondering how you see those things impacting children and youth now in DC, in your work. and I definitely would love for you to draw on some of that community organizer part.
Yeah, absolutely.
And access to mental health. Thank you for adding that to the chat. Very huge, the presence of a mental health concern in the family, anywhere in the family. But also, access to that care is just a huge determinant. But I'd love to hear what you think about how that lands with kids. I'll give you a second to think if you want, 'cause I
Yeah, no.
agree, but
It's
I'm
a
going.
it's a great question. Comprehensive. I'm going in a lot of different directions, but I think a lot of what I'm thinking about is you know, we know that so much of the social fabric within our communities keeps being stripped away, right, by policymakers, by people who are in power, by decision makers. And I think that um, yeah, like, and not only is that impacting like families, young people, children in real time, it is also like limiting the actual like choices that they can make within their lives. And a conversation I've been having a lot with people through the last few years is just like, um, when young people, there's a quote about how when young people don't have the warmth of the village, they will light the fire to still like just feel that. Yes, right. Like they still need to feel some sort of warmth. And I think that we are seeing that in real time of just like how much has been stripped away from youth, from third spaces, from community supports, from elderly care, from mental health supports, like everything you just listed. Um, and it really shapes not just the way like young people's brains are developing and the level of quality of life, but it's also shaping the way more limited choices that they are able to make throughout their lives. So I think I'm still gonna marinate more marinate with that question a little bit more, but I think that's like the first thing that's really coming up for me, and I'd love to pass it on to anyone else if they want to add upon that.
Yeah, I love that you mentioned third spaces. And I saw Dara nodding. So
Yes.
before
And
I,
green spaces and right, like green spaces too. But yes,
Mhm. Yeah. So Dara, Crystal, either one of you are more than welcome to jump in. Otherwise, I will tag you if you want.
In terms of the social determinants, I would say like our kiddos are dealing with competing priorities. They might be having to bring their siblings to school because it's not safe to go outside, helping them with their homework, trying to figure out, is there going to be a community shooting that day? I hate to say that, it's a daily reality for a lot of the kids I work with. And then they were up all night having nightmares. And now they have PTSD and they have anxiety. And the school's going to blame them for acting out, but they're acting out because they don't know how to process their own emotions because their brains are developing. And now their brains aren't developing in the appropriate ways. And now the teachers don't know how to deal with it because they're not trained. Now they're doing burnout. And now the parents are burned out because they're trying to advocate for their kid because it's not their kid's fault. And so it's one of those things where we have to find a, I think something Veronica said, there's no like single issue life that we live. We have to find a way to kind of tackle them all at once, but also recognizing that we're not superhumans. Hence why I love being able to like bring back in what you said, and hopefully Crystal will probably ping back in even things she said earlier, that we have to rely on that village, strengthen our village, and we strengthen everybody.
Yeah. I do think the competing priorities and capacity is a good way to look at things. The capacity question for a lot of our families is a really big one. And what are the barriers to them increasing their capacity? And I think something Crystal talked about earlier, which was community, right? The importance of community for, in her work, supporting families that have just added somebody to them. But I think that connects all together. You can't have a lot of, you will have less capacity by definition when you are not in community. And I see the chat nodding on that too. I really like that. I appreciate that. So Crystal, I was going to ask, is there anything you wanted to add around, how social determinants are hitting the families you're working with and what you're seeing, particularly young people with disabilities?
Yeah, but I think first what I would add is kind of where the conversation is going now is like understanding the impact of all the social determinants of health also provides us an opportunity to do something greater with it, right? To overcome, to again, like bind together with our community supports to overcome. And so I think also keeping that centered is important. And I'm still fairly new to AJE, but it sounds like that's the work that you all do in empowering parents to understand, like, even though this is the obstacle, we can link arms and, like, carry on into the next thing. And that's exactly what I do within birth work, right? Like, we understand that birth is a scary space when all of those things are happening, but how do we claim joy in those moments, right? How are we still centering the fact that this is a beautiful experience and can be and should be and will be when you have someone who understands the intricacies of it and can help advocate with you for you in those moments. And so, yeah, I'll leave it there.
I have great hope for the idea of health and healing justice and health justice being a unifying theme that we can organize around and create political and cultural change in our culture, here, just on a big picture. So I completely hear what you're saying about how, like, look, we can do more, right? We can do something greater in this conversation as we talk about these social determinants. Um, and I really love, Amy mentioned in the chat, that time is also a constraint in this conversation. And I think that when we talk about capacity, very often, sometimes what we're really talking about is the cognitive load that families are carrying, and also just the lack of physical time that they have, and that really ties into, everything about jobs that you've said, everything we've talked about with transportation. All of these things are just it's a very tightly woven web in many ways. Which brings us to, we just talked about a web, the gaps. We've talked about what pressures are on families and what's making it hard. Where are the gaps? What gaps do you see in the services? And where do you want attention to be paid? That you think, what are places where you could maybe hit some of these social determinants if we could fill one or two of these gaps. We're not going to fill all of them. Um, I mean, the question is, the biggest gaps in coordination between education, healthcare, and social services for youth with disabilities. But I think what that really translates to is, where are the gaps that we need to plug so that families can do what they need to do to get where they want to go. And I see Veronica nodding. And I see Crystal looking
I
interested. I will not make any of you go first.
I
Um,
I can go. I think what's coming up for me with this question, and again within the lens of like end of life and yeah, just grief, support. I mean, there are gaps just across the end of life spectrum, like for everyone. So then when we really like hone in on young people, on children with disabilities, I think that there is just such a lack of any sort of like grief or bereavement support in any space, right? Whether we're talking about like social work or like physical health care or even within education systems. And again, this applies to everyone. But I think that there's also like, again, honing in on something that's culturally competent, trauma informed, and like really moving from like a healing lens, like just spaces for like children with disabilities, young people with disabilities to have spaces for grief. Because when I'm talking when I'm talking about when I talk about being a death worker, I'm not just talking about like death and grief from dying. It's like there's all kinds of grief that like people need support with, just like processing. So I think that's what I would like speak to right now. It's just like we need more spaces that are really um, accessible for children and young people with disabilities to be able to process. And processing looks like so many different things, right? Um, so I think that's what I would speak to.
okay. Do we have other favorite gaps? I hear, and I'm translating, Veronica, what you're saying into, not only increased spaces for increased mental health access, but also all the other ways that we process grief, right? And that doesn't necessarily mean, in a clinical setting. That can mean, arts programming. That can mean, you start
Peer
hiking.
support.
There's a million, peer support is huge.
Yes,
And really seen a diminution, I think, in the last few years post-COVID. Um, So that is definitely one gap that we see hitting a lot of families in different ways. Dara, Crystal, do either of you have a favorite gap? I personally, had my kids pre-FMLA, so I'm always about the gap around, my goodness, paid time off to have the baby.
I'll jump off of your performing arts programs there, and I see Ebony mentions trips and clubs. I kind of have like a trifecta of interrelated ones. So I'd say we need to give our parents grace in the morning for attendance. A kid might be late, find a way to help them catch up. Again, the physical time and trying to call them out on chronic truancy when it may not actually be a truancy issue, I find to be very problematic. That also connects to access to childcare. It could be before morning childcare, after the school day is over childcare, and that's not just taking care of the child, keeping them busy. That's engaging them in learning opportunities and finding ways to build relationships with those staff and with their peers and enrichment. That can help them across their entire lives. I loved clubs growing up in middle school and high school, and even some elementary schools across the country will have those type of enrichment programs too, which of course also connects to transportation, one of AJ's favorite topics for children with disabilities. Honestly, children across the spectrum, but especially children with disabilities. It's a big, big hole. But if we had reliable transportation in the morning, they can get there and have breakfast, have a good day off, talk to their favorite teachers who are there. And if you have reliable after school transportation, they can get to their tutor if their parent happens to connect them with the librarian or any tutoring program that might be in the school or sports or whatever. Transportation, ding, ding, ding. And I'll pass it off to you, Crystal, unless Maria has a comment.
Not a word, except for I love that you're talking about transportation.
Yeah, that struck a bell in me too, because prior to birth work, I worked in education and I was the one that had to make those calls like, hey, y'all not here today. What's going on? And then, and I'd figure out what it is, and then we figure out, what resources the school had to provide to the family. But like that can also transition into birth, right? So if kiddos are in school and mom's having another kiddo, and now she's early postpartum or post delivery and should not be getting other kiddos to the house. She needs to be home resting, right? That's another layer of, right, the social determinants of health, right? And also if she is aware of doula support, that can be something that can be a tangible support to like help her plan who in the family is supporting, what neighbor can help out, like what family friend you can call so that everyone can still be covered and, get where they need to be. Or you can effectively communicate to the school like, hey, we just had a baby and this is not working right now. Can you excuse us for a couple of days, right? Because that communication can really, be a game changer. And I think that also leads to my initial thought about gaps in this space with education, healthcare, and social services is just I think I just said this though, but just the blanket awareness of doula support, right? And that it's available to all types of families, no matter where you are. It is covered through all of our Medicaid providers in DC. There are varying levels of participation from the doulas because there is a very tricky pathway to be connected to reimbursement, but we're trying to work through that. That's another subset of my work that I'm excited about, but it's work for sure. However, right, understanding that there's also, right, abortion doulas, there's fertility doulas, there's death doulas, there's birth and post-delivery doulas. And so, right, that care is all encompassing and comprehensive for families. So that's the thing that I always love to share with people, just to understand that doula support is available and we're here for you. But sometimes it's a little hard to find us. So, but now you have two on the phone right now. Well, on the call right now.
I think one thing I really have appreciated about the growth of the doula movement just generally is one, I think it's been responsive to the lack of capacity to do some of the soft side work in other medical professionals. Nurses and doctors don't have as much time as they used to. And on top of that, I think community capacity is limited. You know, my mom could not take off work to come stay with me, and I think a lot of families experience that. Um, Daniela wants to do a quick poll, so I'm going to pause talking for a moment while she jumps in and does that. But I want you to kind of think about, because we've all talked about these like high level ideas, and we're going to switch over to some more concrete things about, you know, what do we want the feds to do? What do we want DC Council to do? Where can we plug some gaps? So hopefully I have talked long enough to give Danny time to queue up the poll that she mentioned.
Thank
Look
you.
at that, I did it. And I will stop talking. Mhm.
All right, everyone. Well, we thank you for being here, everyone. We really appreciate you taking the time today. We're going to just pause. We want to ask you 2 questions just to see what you're getting out of this conversation. I'm going to launch the first one right now. Okay. Do you believe DC's current systems, education, healthcare, and social services work well together to support children with disabilities? Yes, I'm seeing a common trend with not at all and somewhat, and some gaps are common. Thank you. I would love to tap into this, but we're also going to have questions and answers at the end. So I'm going to go ahead and also now ask our second question. Let me go ahead and send that out. Which social determinant of health feels most urgent in your community? Housing stability, food security, access to mental health care, education quality, public safety, and transportation. Housing, we're getting the most hits with housing stability right now, and access to mental health care. Okay. We also have some food security and transportation. I also think this is a hard question because what if you have all things happening at the same time? But thank you, Maria. I'll pass it back to you.
Awesome. Thank you. You know, one thing I say all the time at work is, you know, I've been working in kind of education rights, education justice for a long time. And then I look at all these studies about how mom's income is the best determinant of educational outcomes. And I just kind of put my hand in my head and said, you know, maybe I should have done, I don't know, like economic development work or economic policy work. Because I think so many of the things you mentioned, you know, we have so much research that tells us what they lead to in terms of health outcomes and in terms of educational outcomes. You know, especially, you know, transportation is all about lots of things. So gaps. And what do we want council to do to fill those gaps? Hopefully our panelists had a moment to think about that. I will tell them that one thing that I am often complaining to the council about and have been saying for years is that, you know, we have a system in DC where we have school choice without transportation support, right? Which is really tough because that means the only students in the district who have a statutory right to transportation to school are students with disabilities. Which really means that we are overburdening that system because we don't have any solutions on the more global level. So I am always wanting council to address transportation more globally, not just for students with disabilities, because I think until we solve it for everybody, we won't be able to solve it for anybody. But that is my doing what I'm not supposed to do, answering the question. But hopefully it gave you guys a time to think of a thing that you want council to do. You know, a gap you want them to plug, either locally or federally, either one of those actors. Any of you want to jump in? And if someone could repin poor Crystal, we lost her somewhere. She's no longer pinned with us.
I think she had something happened because she's not on
okay.
the meeting.
We lost
And everyone, if we could just have your questions be typed in the chat, we will have a portion at the end to answer some questions.
Perfect.
I'll give Veronica a break from going first. One thing I want both the federal government and their local government to focus on is funding, effective training, and roles for mental health workers at the schools. A lot of the time, our schools either won't have them or they're sharing them, so they're not there that day. It can even go as far as school nurses. It could also be different aides and staff on those actual buses. If you have a kid with autism, for example, and they don't know how to process this new transition to a brand new school because they're going from 5th to 6th grade, for example, they may not get on the bus. They're not getting on the bus because they don't want to go to school. That could be part of it too. It could be because they haven't built a proper report yet, because mom was begging the Aussie transportation staff, for example, to come meet their kid a week before school started. Or it could be a kid who's having a tantrum in the middle of the school day because they're being bullied and they don't know how to handle peer conflict resolution. There needs to be staff who can come from the trauma-informed approaches. There needs to be enough staff for the different proportions of kiddos in those classes, especially the ones that might specialize with kids with certain kinds of IEPs. Do you need social emotional supports even if you don't have an IEP or if you have a 504 plan? So that's going to be like my big funding push is need the physical bodies of the qualified people in every single school and hopefully on every single transportation vehicle that transports a kid with IEP services.
Yeah.
Thanks, Tara. Were you gonna say something, Maria? Or
Yeah, I was just gonna say, I love talking about staff training because sometimes we talk as if having bodies is enough, and it's not. You know, bodies that are not actually harming students, I think would be is like a baseline, and then we can actually get to like bodies who are helping students and healing them and moving them forward. But all you.
yeah, Chioma is probably knows what I'm gonna talk about a little bit. But I have a maybe two or three to pitch. Two, three like things that I absolutely believe like DC government can do and should do. And one is like overhaul our current mental health crisis response system. It is deeply carceral, it is violent, it is deadly. And that's, how Chioma and I actually met through doing work around DC's mental health crisis response system. I think that, again, speaking to what y'all are saying, we need people who are trained and who can do this work well and can do it with care and treat people with dignity. We need places where people can go that are not, again, like carceral, that are not moving in ways that are like taking away young people's dignity. And yeah, we need people like that they're not just like someone to talk to, but also people who can respond in appropriate ways. And that can be, again, like community support, peer support. It doesn't just have to be completely linked to government funded organizations. It could be also using funding that will train community groups that are already doing this work, right? We know that there are so many that have been doing this work and they have been deeply underfunded. We also need to overhaul so much of our housing policies, right? We need to expand and strengthen our rent control laws. We need people to be able to not be displaced from the city, from having access to a lot of the supports that they need. And I know that DC is also, a lot of DC folks are working on the guaranteed income, which goes back to what you were saying, Maria, about this the research around one of the biggest determinants of how families will do is based on a mother's income. And there are a lot of groups here that are really moving that pilot forward. So I think that that is something that DC government needs to fully invest in.
Yeah. No, and I appreciate that. And Crystal, I'm so glad to have you back. I asked everybody what's the thing they want the council or the feds to do, right? What is a place where, there is an action that could be done. And I think we've heard a lot about income, housing, competence and training for staff serving students around mental health issues. I love, Veronica, that you mentioned the lack of a continuum in our mental health space. DC has community-based support, sort of, and full support and inpatient. There isn't, an intensive outpatient that's available to students. There isn't a partial day hospitalization. And that's something that drives me absolutely bonkers. because I think you're right. It leads to a much more carceral approach and a confined and segregated approach to mental health. But I said all that, Crystal, to give you a recap while you were joining and give you a chance to answer. So if there's something you want council or the feds to do, oftentimes I think in DC we get a little nervous when we think of the feds doing things. But if there's an action, I'd love to hear it, and I think everybody would. Oh, and you're on mute, because I think from you when you rejoined.
Okay, sorry. I had to get on my phone because my laptop is like playing games. But thank you for thank you for the recap. I think I was alluding to this a little bit about what action I'm looking forward to government to support or possibly even more so collaborate on because as we know, the system doesn't system or it systems in the way it's supposed to, which allows a lot of people to fall through the cracks, and that's not okay. And so my I don't know, the hill that I'm always standing on is advocating for doulas and increase access and awareness for doula support so families can have access to that care and understand what it is, why it's important to have, and how being supported in bringing your child into the world can literally change your trajectory for supporting that child in all the things, in all the ways. And just understanding that like having support in that space isn't like isn't a taboo thing. You know, like that's it's empowering and can be or should be. And I think that is kind of what I'm hearing about the empowerment model here at AJE, and that parent-led advocacy. And like if you receive that literally from the get-go, right, like as soon as you know that you're pregnant, and then you find other ways where you can lean on support to empower you through your everyday choices, through advocating for whatever supports your family needs when you're learning that your child needs more. It's just care, right? It's not something that, again, it's not a taboo thing. It's just like, this is what my child needs, and I need support getting it. Who's going to help me so that you don't have to be bogged down by the fact that your child needs more care or different care or whatever type of care that's required. It's okay. It is what it is. And that allows you to be confident in your experiences and how you move through the world. And I think that that's of the utmost importance. So the work that I'm doing currently as I co-lead the Doula Learning and Action Collaborative, we have DC Health and DC Healthcare Finance on our team to collaborate to increase access and awareness to doula support for families and for doulas. And once we figure out this like reimbursement piece, then I'm bringing my team over to HSCSN to provide that care specifically for families with special needs to again create community in the birth work world, or even just build up, because I can't say that there's not a community. I'm just not quite in it just yet. So to link arms with those who are doing that work here to again create more access to birth support for all families. So that's where I'm at.
The last question I'm kind of supposed to lead with is effective advocacy strategies and what can we do, right? And I think, Crystal, you said something that I really like, and I want to kind of flag it for everybody. You said the thing I'm working on, right, is lifting up doula experience and talking about doula access. And I think sometimes, we can't work on everything all the time, right? Um, and I really appreciate your like, hey, look, I can't work on all the things, but I can work on this thing. And I think working on this thing here has ripple effects, right? Because you're right. Once we take one thing off the plate, once we make a little more space, we can make more, there's possibilities to maneuver in ways that maybe we didn't see when we had that in front of us. So I appreciate that very much. Also because, I've spent my whole life working in education, so I'd like to think I'm doing something here.
For sure.
But that is kind of the concluding question is we're like, okay, what can what do we want policymakers to do, but also what do we want to do and how do we want to do it? And I think that um, that's a harder question to ask than to ask and a harder question to answer than maybe we always acknowledge, especially as we're already 3 minutes over, right? Because the temptation is to answer it with everything, right? We're going to do everything all the time. I'm going to work on food and housing and access to healthcare, and all of it all the time. And sometimes we can do all of it all the time, but most days we can't. Most days we need to prioritize. So I've kind of taken the effective advocacy strategy away from you because I'm like, your effective advocacy strategy is to pick one thing, and I'm not saying that. But what are strategies that you like, and what are things that you think, individuals can do? Um, I think that I have real value in the telling of stories, right? And I think that that has real inherent value, not only for the storyteller, but for those who hear the story and can see the policy connections, right? Because I think sometimes we just don't see them unless we hear it in a narrative form, because that's how our brains work. Um, so I'm gonna let anybody who wants it can go first, but strategies that people in this conversation can use, right? Strategies from here. Um, Anybody can go, unless you want me to.
Hello. Sorry. This is
Oh, oh, I think somebody accidentally came off mute by accident.
Ah,
I think that's what that was. But Dara, you're off mute, so you get to go next.
oh, goody.
Uh,
All right, so effective advocacy strategies. I'll say two that I like to tell all of the parents that I work with. One, it seems like it's on a case by case level, but it can also be used later on a later bigger advocacy scale too, is keep all of your papers. Establish a culture of written communication. You'll need it for your child, you'll need it for your child's best friend. Talk to the other parents in your class. I like to say, this is number two, create a mini PTA within your child's immediate classroom. You don't necessarily need the entire school. That'd be great. But start small, get bigger. Whatever, kids need chunks, parents need chunks too. And then you might notice patterns. If there are patterns, there are systemic legal opportunities that you have that AJE would love to help with, and other organizations we know would love to help with, and give you the tools to then aggregate those stories. Small steps lead to big changes, power in numbers, when you do testify in front of council or Congress or write your letters.
Well, I love that culture of written communication. I know that's hard, but it's hard in the moment, but it makes such a difference down the road. Um, yes. Oh, and I love Amy has a note in here, you know, remembering who funds this work. One of the things that's deeply heartbreaking for me is how many of the families I work with are talked to and treated by the school. And I always like to remind them, I'm like, look, I mean, there's governance problems in DC because there's limited democracy in how education is governed in DC. But ultimately, the residents of the district pay for that service. Um, Veronica, you look like you wanted to say something around effective advocacy that people can
Yeah.
do here today.
Absolutely, absolutely. And I'll just add one last policy thing that I think we should push forth in DC is also expanding DC paid family leave. I know some of it's already on the chopping block this budget season, but I think about there are so many people who are still not covered and are still not protected by what currently exists. And those people need to be in the room, really creating, expanding upon that. But
Mhm.
coming back to effective advocacy strategies, I believe in the seasonality of all things. We will all go through so many seasons in our lives, and I think that we can play different roles. I have been a youth care worker, I've been a case manager, I'm a community organizer, a death worker, and right, and now I actually do a lot of storytelling work within my own organizing collaborative, and I think that it's important to know what capacity do people have at any given point in time to really move through any level of strategy. But one of my favorites is being in coalition with other groups of people, because while you may be focusing on a very specific thing, having a well-rounded space where people are have different context, expertise, um, and just experience will make any group. And when I say coalition, let's use that very broadly. It can be, like Dara said, in a class setting. It can be a coalition that's trying to pass policy. It can be it can be in your community. It really can be any group of people that have just different have like shared struggle, but different context and experience to really work towards something. I think also joining, not worrying about, not trying to reinvent the wheel, and joining groups that are already doing the work, right? Because it can feel so overwhelming to know you want to address the thing, and then where do you start? More than likely, there are already groups doing something like that, and just really connecting with that. But then that means we should have a directory. And also, the last thing I'll say, while there are so many things to be done, so many groups doing different things, I think one of our Achilles heel is when our work is deeply siloed. Um, and we're constantly just doing the same things over and over again. When, again, while we may be focusing on different parts of the work, we can still be in deep communication and relationship. So we can really push forth a lot of the work that needs to get done.
Yeah. That's one reason why I love our parent cafes, because they are intentionally designed to create that soft coalition and connection, right? And it's right. It's like Dara said, it's a mini PTA. You don't have to recreate the wheel. You don't have to create a whole new giant nonprofit or a whole PTA. You just need other people you can talk to.
Yes.
Yes, I mean the power of a really good group chat, I think, is something that we don't always appreciate. And I think that is a thing that we can and do need to do. And I really appreciate you mentioning silos. That is a powerful, powerful thing. I am mindful of the time because it is 7:10. And I know that Chioma and Danny have more content and definitely some Q&A room. Um, but I do want to just highlight something that I think everybody keeps coming back to, that I think we can hold in our hearts a little bit as we think about this like broader health policy camp, is this notion of the interconnectedness of these issues. Um, and where can we work, and where can we work effectively? And I really think a lot about that. Where is the space that I can navigate now? If council doesn't want to hear me talk about X, okay, fine, I'll talk about Y. Um, and I think that's a really both profound and pragmatic thing, right? It's like can't do everything everywhere all the time, but there are some things we can do. And we need to be pragmatic and also keep that big picture in mind. Um, and I love our chat, by the way. We have had a really wonderful, awesome chat here that's been like, inspirational, and then we're gonna go get them, and then I joined a board. We're gonna do this like nitty gritty. So I love that. But I wanted to ask, are there questions that people have while we have we have a nice mix, honestly. You've got an attorney, you've got some doulas, you've got people working in the educate, you've got a nice mix of folks. So are there questions or anything that people have while you're here? Schools don't. Yeah, there's a rhetoric around parent engagement that is often not matched by how parents are received. We want you to engage with us in a certain way in a certain time, and not in a way that involves yes. Um, you know. Um, oh, I love this, less barriers. Yes. One thing that we do see, I think, Ebony's comment is, less barriers for students who don't have a particular label. We talked about that the other night at the State Board of Ed. Classification creates an arbitrary barrier to different services. And we see that in multiple spaces, right? We see that in the education space, but we also see it in the healthcare space. Let me see. Are there other questions? I don't know.
I wanted to this is Emil Hudson. I'm a parent organizer with AJE. And I just wanted to address something Veronica said about paid family leave. And I just wanted to remind you that we have a panel this Thursday about barriers to caring for the caregiver, where we're going to be touching a lot on that. So anybody who if you think needs to be in that room, please let them know about it. Yeah,
Thank you, Emil. I need to be in that room.
absolutely.
Thank you.
If there's no questions, we do have 2 more poll questions that we wanted to send out to everyone. So let me go ahead. We have, after today's discussion, do you feel more confident advocating for disability health equity? Oh, I'm loving it. We have yes, absolutely. A little more confident. Not yet, but I want to learn more. And we love that because, Emil, can you share the flyer in the group chat? You all can definitely pass the word along. We will be having more panels throughout these 2 weeks. So the more the merrier. We want to really make sure that we're spreading the knowledge and getting our communities on board, especially with the mission that we have throughout all our teams and our community. Knowledge is power. Okay, and then we have one more. Give me 1 second. What type of action are you most likely to take after this session? Share what I've learned with others, connect with local advocacy groups, testify or contact a DC council member, link into services, resources for my child and family, or I'm not sure yet. Thank you. Got a little bit of everything. It's interesting how, okay, we didn't have no one vote for connect with local advocacy groups, but someone just voted for that. So I love that. Maybe we can share out some groups and other organizations. Tomorrow, Chioma and I will be presenting at the Ward 8 Health Council meeting. Crystal Jackson will also be there. So we will be presenting a little bit about our project and some of the findings that we've had with connecting with families and the youth in DC and some of the challenges that they experience within the healthcare system. Okay, I'm just going to share a little bit about the poll so you all see where we were at with everyone in the room. I see that everyone is leaning in, well, not everyone, most people are leaning into share what I've learned with others. And I love that we are in that space informally and formally as well. Okay. All right, Chioma, I'm going to pass it along to you.
Okay. And with that handoff, I'm going to jump out. It's been a real pleasure listening to everybody, and I enjoyed moderating this conversation and hearing so many voices. This was wonderful, and love the chat. Love the chat. Chioma, thank you for inviting me, and have fun, folks.
Thanks, Maria.
Okay.
As we are glitchily working through trying to pin myself, which I'm not great at chewing and walking and doing things at the same time. So I just want to add, thank you all so much for the panel, and I hope you stick around. We're just going to take a little bit more of your time for tonight, and I'm actually going to unpin everyone else and thank you for our panelists, and we'll circle back. We want to keep everyone close. This is just the beginning. We are starting with our this is an orientation as well as it is an open programming, learning programming. It's an orientation for our parent ambassadors. Many of the participants, not all, are newly signed up parent ambassadors. And so this is considered their orientation. And we're going to, beyond this, be doing a lot more community engagement work, things coming down in the fall and beyond. So we would love for our panelists to continue to stay on and hopefully join the chat if you haven't already, which is our Community Health Advisory Panel, and we meet bi-monthly. So I don't know, Danny or Emil, can you help with the unpinning of people portion so that I can
got you.
talk? Thanks. So I will then just we meant to share a couple of polls at the beginning, and I want to talk about healing justice, and we're just going to end on that note, and want to start reverse back and post up those polls. Danny, can you Can you host those polls? The first one, I'm trying to get it up here. Okay, I think I see it.
You got it? And let me know.
Okay, yes, I do. I got it. So the first one that we asked is, how familiar are you with the term health justice? Okay, so we got one person that's very familiar. Lots of people are familiar with health justice. Great. Some have heard, but don't necessarily fully understand. And all levels of knowledge and or not knowing new concept, all are welcome. Please do not feel any kind of way of not ever hearing about it or not fully knowing what that means, because we're going to talk about it. All right, so I'm going to end it and share it. It sounds like, yes, fully aware. Amy, you sound like a very interesting person, and I very much look forward to being in community with you. So this is the result. So we will we'll get into that in a second. And then I want to share one last poll. This is the last poll for today. And that is this one. Are you going to let me ask the question? It may not let me launch the poll.
I got you, Chioma.
Okay, thanks. Okay, so it is sharing and it says,
You're
what
right. It doesn't let you.
it doesn't let you. Okay, so never mind. We may have to relaunch that poll. Let me see if it lets me do it in the meeting. No. Oh, technology. Yeah, so we'll just leave that and just talk a little bit about healing justice, because we know this is a marathon. We have lots of sessions and lots of days. We want everyone to keep coming back. So to kind of do that, and as we build trust, try and not overwhelm you with too much information. But if you look at the link I just put in the chat for the live binder, you will see
Thank you.
a bunch of one-pagers. And the first one that you'll see on there is the one about health justice. So I want to talk a little bit about
Sorry, Chioma. Can you make sure you send it? I don't see it in the chat.
the live binder.
Yes,
The
but if
last-
not, go ahead. I got it.
Okay, if you could drop it in the chat, please. There's also a QR code on the slides that I sent. Maybe if you want to share that really quickly, would be helpful. But just very, very quickly about health justice. So health justice is, our project was called the Health Equity Project, and we recently changed it for a couple of reasons. One, to match the climate that we're in. We are federally funded in some ways. And so we know that word is not very welcomed in the current federal climate. But it's also a radical concept, a concept that is community-centered. For me, radical is just the quest for truth. I don't know what other things people put on the concept of radical, but that's how I'm using it operatively in this moment. But just recapping from that health justice framework, which is very connected to healing justice, which is a concept that was developed by Black and Brown organizers in the South. The practice of building resilience and safety and wellness. These are things that are extremely foundational to actually achieving any equitable results that we want to see by reducing disparities, by prioritizing the voices of the most impacted, just reiterating things that our panelists have said. So we, on a one page, we'll put 4 strong buckets in which we think are important to transform systems from a health justice framework. And that's putting families and community directly impacted people at the center. Those who are closest to the power, to the pain should be closest to the power. That's an abolitionist principle. To ensure access to quality, culturally responsive tools in order to navigate things like language access is extremely important. We definitely aspire to hold those values up. And I want to be self-critical in this moment, in that we know that one of our participants is part of the deaf community. We intend to be accessible at every juncture and provide language translations, including ASL. We do have an ASL interpreter for Friday, and we were not necessarily aware ahead of time and enough time to be ready for every session. But we know that this is a huge part of health justice, and call us out, call us in. Even we are growing and learning. So when we say the need to prioritize access from a culturally responsive space, that includes everything that we're doing here, even as that may not 100% be reflective in this moment. We do have a Spanish translator, speaking translator, that's on here, as we thought we were going to have at least one community member that is a first language Spanish speaker. But that is a top priority for us, and we hope it's a top priority for the healthcare sector, which it's a life and death situation if you get accessible care or not. And we also believe that fighting for the policies we want to see, the big ones and the small ones, to reflect the experiences that the things that we experience, is critical, especially when it comes to the disabilities communities. Many people have lots of opinions about what constitutes a life of somebody who has a disability. But what we should be aware is that there's so many different kinds of disabilities, and sometimes you cannot cookie cutter what a person needs, even if they are in the same disability category. So our policy should reflect that degree of individualization. Also, connecting healthcare to the other determinants of health, I guess, from the framework of, we've talked extensively tonight about the social determinants of health. I'm a political scientist, and I very much believe that there is a foundational need to also link the political determinants of health. There's actually a book called The Political Determinants of Health. I forget the author's name, but I believe he is a professor at Morehouse University. I'll look it up and share it at the next. But the political determinants of health include access to voting, access to democratic channels to talk about policy changes that we want to see, access to your elected officials. All these things, I think, are critical to connecting the dots in the way we want them to connect, for healthcare to connect to housing, to connect to food, transportation, and all the things we've talked about already as the social determinants of health. In our quest for healing justice, there are key principles that we also engage while we look at the priority areas. So without healing, there is no justice. So we also know that it's a lifelong process and practice, right? That we will never get to the end of healing. However, part of the quest for the justice of having healing spaces and healthy spaces and well spaces is that awareness being central to everyone, not the special category of disabled people, but also the service providers, the people who are in the delivery system. Their healthcare matters, how they show up in their spaces matters, and it does matter in terms of the ultimate outcomes. If we don't other people in the process of, framing what people in a community need. Another principle is justice should address the whole person, right? That we believe in systems should reflect not just the fractured of ourselves, that oppression and liberation can they may sound contradictory, but they do coexist. Certain people, we're all differently positioned in society. So you may be a lawyer, for example, but as long as you're a lawyer who is a child of a parent of a child with a disability, or you're a disabled lawyer yourself, that intersection, that connection between who you are, your deficits, and your assets should be looked at wholly and totally as one looks to assess what kind of needs that you are going to have resolved in a society. We believe that all minds and all bodies deserve justice. So that is an anti-ableist approach to this work. We know that ableism is perhaps the least understood of discriminations because we all are beholden to having our limited mindsets being imposed on people for, whether we mean well or not. The more aware we are of that connection, that in systems marginalize people, particularly those who are disabled, that we build multi-generational, multidisciplinary, that the more diverse our movements are, the more we allow our diversity show up in spaces, the more chances that we are going to create healing environments, and that our work must be trauma informed and resilience centered. And sometimes I do feel that the insistence on resilience is a form of violence in and of itself. Especially if we want people to be resilient and we don't actually have any material tools to support that resiliency. So when we say resilience centered, that also means that is the justice of it all, that people should have the opportunity to bounce back, that people should have the opportunity to fall and take their time to recover as needed. And that recovery process should not look like completely devastating and altering your way of being. And that resiliency is strategic, right? So there is times, you're going to be burnt out in this work. There are times that you're going to be burnt out in your mother work, in your caregiving work. That as long as that we are here to support each other, part of the principles of mutual aid, part of what we're growing here longer term is, trying to ground ourselves and ground AJE's work in, meeting those very basic needs that, especially in the new political climate, based on the one ugly BBL bill that just passed to the one big beautiful bill, as it's called, formally, just to not confuse people so they know what I'm talking about, but that we're living in unprecedented times where we really have to live the principle we keep ourselves safe because no one is coming to get us. And on that note, that is the learning again, in terms of healing justice. If there are more thoughts in terms of that, I want to open it up. I'm going to invite Danny and Emil, our team members, to come in this space and add any last minute thoughts. And then we also want people to fill out the evaluations, but let me add Danny and Emil if you guys want to give some reflective thoughts before we bounce off.
Yeah, I want to thank everybody, especially our panelists who take the time today to be able to join us. Thank you so, so much. We really appreciate and value your time. As far as what we have going on for the rest of the week, thank you, Emil, for sharing the flyer, and we hope to see everyone following us along for this camp.
Yeah, I just want to thank everybody, especially our panelists. We have a lot planned for the next 2 weeks. I want you guys to especially look out for our parent cafe that's going to be in person Friday, July 25th. I think that's going to be a great space where we can really get to know each other on a personal level and begin to start thinking collectively. But no, I just appreciate everybody here. I learned a lot, and I'm really just excited to keep learning throughout this week with y'all and growing. So yeah.
Okay, great. So on the can somebody paste the registration link for Thursday? So just to kind of share, you'll see in the live binder the daily schedule. If you fill out the registration form, the Google form, we will then send you out the registration link. But for those who are in this meeting today, we can put that in the chat so you can register for Thursday. Tomorrow's session, we're going to be presenting our community needs assessment at the Ward 8 Health Council, as Danny mentioned. The address is 1801 U Street Southeast. And then Thursday, we have a workshop, and that is for parents. We encourage parents, primarily our ambassadors, to attend that. And that's going to be about storytelling. And also, as Emil mentioned, we're going to be unpacking paid family leave and family FMLA, family medical leave, and just the things we need to do to take care of ourselves in the workforce as we, who cares for the caregiver? Many people do not understand the sacrifice that parents and other caregivers make in order to show up in our households, but we do, and we're going to talk about it. So, and then Friday is going to be our community health advisory panel meeting. We meet bi-monthly, but this is a special meeting as we introduce our new ambassadors, and we hope everybody joins that meeting on Friday. And that's that. And then our evaluations. I hope people take the time to fill out the evaluations in the last minute. So we can set the, clock, and we're going to stop recording so that we're going to upload this on YouTube. But if we set the clock for 5 more minutes, if you could please fill out the evaluation before you log off, we would love for you to do that. Thank you all so much. And we hope you continue to join us for the rest of the sessions in these next 2 weeks.
Already did mine.
Oh, thank you, Amy.
Yeah.
I'm gonna give a shout out to Amy because when I gave all the links for the workshops and the panels, Amy responded with, I signed up for all of them. So shout out to you.
Yes. I mean, because everything that the workshops are talking about is literally everything I'm going through right now. Literally. So I'm willing to